The night they mocked the new ER nurse was the same night an Army Ranger died under fluorescent lights, and came back because she refused to obey the wrong man. Rain slammed against the windows of St. Adrian Medical Center while exhausted nurses pushed through another endless shift in Providence. The smell of antiseptic burnt coffee and wet uniforms hung heavy in the air. Families waited for answers, monitors screamed from behind curtains, and in the middle of that chaos stood a quiet woman nobody respected enough to notice. Her badge said Rachel Cole Wren. What nobody knew was that her hands had once held open chests in places where helicopters landed under gunfire and soldiers bled out in the dirt before sunrise. Tonight, one wounded ranger is about to expose every lie inside that hospital. Stay with this story until the end and tell me in the comments where you're watching from. Would you have trusted the nurse everyone else ignored? The question still hung in the air as the storm pressed harder against the hospital windows as if the city itself wanted an answer. Would you have trusted the nurse everyone else ignored? At St. Adrian Medical Center, no one was thinking about trust at first. Trust was too soft a word for an emergency department at 1:17 in the morning. The place ran on habit pressure caffeine and the thin patience of people who had already given more than they had left. Outside, Providence was drowning in winter rain. The streets beyond the ambulance bay shone black beneath the streetlights. Water rushed along the curbs and slapped against the tires of parked cruisers. Wind pushed loose newspapers across the sidewalk, then pinned them against the glass doors like messages nobody had time to read. Every few minutes, the automatic entrance opened and let in a gust of cold air, wet wool fear, and city noise. Inside, the emergency department had its own weather. Fluorescent lights burned white over tired faces. Monitors chirped from behind curtains. A printer spat out discharge papers no one had time to collect. Somewhere near triage, a toddler sobbed in the exhausted rhythm of a child who had been awake far too long. In the waiting room, a man in a soaked Patriot's jacket kept standing, pacing 3 steps, sitting down, then standing again, as if movement could make the doctors move faster. The smell was familiar to everyone who worked there. Antiseptic, burnt coffee, plastic tubing, damp coats, old fear. Rachel Cole stood at the edge of the nurses' station with a paper assignment strip in her hand and said nothing. That was one of the first things people noticed about her. She did not fill silence just to prove she belonged in it. Her navy scrubs hung a little loose at the shoulders. Her dark hair was tied back cleanly without a strand wasted. Her badge swung against her chest when she moved. Rachel Cole. The badge was plain. The woman wearing it was not. She was not tall in a way that demanded space. She was not loud. She did not walk through the ER with the bright, nervous energy of someone trying to impress the older staff. She moved quietly, almost economically, as if every step had already been measured before she took it. New nurses usually announced themselves without meaning to. They apologized too much. They hurried down halls and forgot why they had entered a room. They laughed too brightly at jokes. They asked where supplies were with the shame of someone who believed ignorance was a moral failure. Rachel did none of that. She checked her rooms, scanned the board, read the pending labs, and looked up only when something mattered. Maya Dawson watched her from the other side of the station while trying to pry the lid off a cup of coffee that had gone cold before she ever tasted it. Maya was 27, sharp-minded, quick with patience, and still young enough in the job to be wounded by every cruel thing said in a hospital hallway. 6 months on nights had taught her that exhaustion could live inside the bones. It had not yet taught her how to stop caring. She finally got the lid off the coffee and sniffed it. This smells like someone boiled a tire in sadness. Rachel did not look away from the charting screen. Then it's probably fresh. Maya blinked, then laughed under her breath. So you do make jokes. Only when the coffee deserves it. Maya leaned on the counter beside her, watching Rachel click through medication lists and scan allergies faster than most nurses could log in. You already saw the troponin on bed 8. Rachel's fingers kept moving, negative first draw. Symptoms still matter. Maya looked toward the curtained room where a middle-aged woman had insisted her chest tightness was just stress. Most people see the negative lab and relax. Rachel selected an order note and closed the chart. Most people like being wrong when it feels convenient. There was no arrogance in the answer. That was what made it strange. Rachel said it the way someone might say the floor was wet or the patient in 12 needed another blanket. Plain fact. Nothing decorated. At the center of the station, charge nurse Linda Mercer lifted her head from the assignment board. Linda had been at St. Adrian for 22 years. She had worked blizzards, heat waves, overdoses, gang shootings, flu surges, power failures, and one memorable Thanksgiving when a deep fryer explosion took out half a family reunion. She had the square shoulders and sharp eyes of a woman who had spent decades deciding which emergencies were real before anyone else finished talking. "Cole," Linda said. Rachel turned. "Bed 12 needs repeat vitals, head lack on blood thinners. CT is backed up. Keep her visible." Rachel nodded once. "Already checked. She's alert. No vomiting. Pupils equal. Pressure stable but trending down a little. I put in a note for reassessment." Linda studied her. "You put in a note?" "Yes." "You've been here 2 weeks." "Yes." "You always this cheerful?" Rachel's face remained still. "No." Maya nearly smiled into her coffee. Linda did not smile, but one corner of her mouth considered it. "Fine. Keep watching 12. And keep an eye on 6 before he tears out his IV and tries to fight the television." Rachel folded the assignment strip once and slid it into her scrub pocket. "Understood." She moved toward bed 12. The patient was an elderly woman named Mrs. Harlan, 81, silver-haired, damp from the rain, and furious with herself. A bruise had begun to darken along her cheekbone. Blood had dried into the hair above her left ear. Her purse sat on the chair beside the bed, closed tight as if dignity could be stored in a handbag. "I'm sorry," Mrs. Harlan said the second Rachel stepped through the curtain. "I know you people are busy. I didn't mean to cause all this." Rachel pulled on gloves. "You fell and hit your head. I was trying to bring in the plants. In this weather." Mrs. Harlan looked embarrassed. "My husband used to say I had more concern for geraniums than common sense." Rachel checked the dressing along her scalp with gentle fingers. "Was he right?" "Usually." "Then he knew you well." The old woman's eyes softened. "He's been gone 11 years. Rachel paused just long enough for the silence to have shape. "Then I'm glad someone is still keeping his plants alive." Mrs. Harlan looked away, blinking quickly. Rachel did not comfort her with empty words. She checked her pupils, asked about nausea, dizziness, vision changes, and the blood thinner dosage. She adjusted the blanket around the woman's shoulders and wrote 3 simple things on the whiteboard. CT pending. Repeat vitals. Call before standing. Mrs. Harlan watched her write. "You have good handwriting. It helps people worry less when they can read the plan. Is that true?" "Most of the time." The woman reached out and touched Rachel's sleeve with 2 fingers. "You're very calm." Rachel capped the marker. Someone should be. When she stepped back into the hall, the ER had shifted again. That was how it always happened. Nothing changed all at once. It rearranged itself by degrees. A curtain opened. A family member raised his voice. A monitor alarm turned from mild complaint into warning. Someone came in bleeding. Someone left with paperwork. Someone received news and became a different version of themselves in a plastic chair beneath bad lighting. Rachel walked through it without seeming untouched by it. That was the mistake people made. They thought calm meant absence. It did not. Rachel saw the man in bed 9 keeping one arm pressed against his stomach while telling everyone he was fine. She saw the woman in triage rubbing 2 fingers against her sternum, even after writing anxiety on the intake form. She saw a teenage boy joking too loudly with his younger brother because the cut across the brother's eyebrow frightened him more than he wanted to admit. She also saw Dr. Miles Hargrove leaning at the physician station in a white coat so clean it looked theatrical. Hargrove was 43, handsome in a polished, expensive way with silver starting at the temples and a voice that could sound warm when administrators were nearby. He carried himself like a man who believed rooms improved when they understood who was in charge. His shoes were spotless. His stethoscope rested around his neck like a symbol more than a tool. He was speaking to Dr. Owen Blake, a surgical resident with tired eyes and the haunted posture of someone who had not sat down in hours. "Confidence matters," Hargrove said, tapping a chart with one finger. "If the room senses doubt, the room becomes doubt. Patients need command." Owen nodded. "Yes, sir." Hargrove's eyes sharpened. "Do not yes, sir me while looking uncertain." Owen straightened. "Yes, doctor." Rachel passed close enough to hear but did not slow. Hargrove noticed anyway. "Coal." She stopped. He did not look up from the chart. "Room 9 has abdominal pain." "Yes." "Labs pending." "Yes." "Then why did I see a note asking for provider reassessment?" Rachel turned fully toward him. "Localized right lower quadrant tenderness. Guarding, rebound." Hargrove finally looked up. "Did he tell you that, or did you decide to become a surgeon during your lunch break?" Maya, standing near the medication scanner, went still. Rachel's expression did not change. "I examined his abdomen during nursing assessment. His pain pattern changed since triage." Hargrove leaned back slightly. "There is a rhythm to this department. Nurses observe, document, and carry out orders. Physicians diagnose. The patient needs an exam. I said document it. I did. Then let the system work." Rachel held his gaze. "The system is not the one with rebound tenderness." The air around the station tightened. Owen looked down. Maya looked at Rachel, then at Hargrove, then back at Rachel. Linda, from the far end of the desk, stopped writing but did not intervene. Hargrove smiled without warmth. "You are very new here." Rachel answered softly, "Yes," and yet very comfortable correcting people. Only when the correction matters. His smile vanished. "Useful nurses learn the difference between urgency and attitude." Rachel nodded once. "Useful doctors do too." For a second, nobody moved. Then a monitor alarm sounded from bed 4, and the ER remembered itself. Hargrove stepped closer, lowering his voice. "You do not want to build a reputation with me, Nurse Cole." Rachel looked at him as if she were reading a vital sign. "No, doctor." "Good. I want the patient examined." Maya inhaled quietly. Hargrove's jaw tightened. "I'll see him when I see him." Rachel did not argue again. She turned and walked away. That bothered him more than if she had shouted. In bed 9, the patient was a construction worker named Daniel Price, 38 broad hands, muddy boots, and the stubborn misery of a man who believed pain was a private weakness. He had one forearm over his eyes when Rachel entered. "Still fine?" she asked. "I told the other nurse I'm good." "You told triage you were good while sweating through your shirt." He moved his arm and glared. "You always talk like that. Only when people lie badly." "I'm not lying." Rachel pulled the stool closer and sat. "Then let's try again." She asked the questions without rushing. Where was the pain first? Where was it now? Any fever? Any nausea? Last meal, last bowel movement, any prior surgery, any kidney stones? Daniel answered like every word cost pride. When Rachel palpated his abdomen, he clenched before her fingers reached the right lower quadrant. "There," she said. He exhaled sharply through his teeth. "I said I've had worse. Work injuries." "Yeah." "Work does not cause rebound tenderness." His eyes flicked toward her. "That bad? I think it needs attention." "That's not an answer." "It's the honest one." He looked away. Rachel adjusted the blanket, raised the side rail, and checked his pulse again. "I'm going to keep pushing." "On my stomach." "On the doctor." He almost smiled, then winced. Out in the hall, Maya caught up with Rachel near the supply cabinet. "You really don't scare easy." Rachel opened the drawer and checked the IV kits. "I scare fine." Maya gave her a look. "You could have fooled me." "That's usually the point." Maya leaned against the wall, lowering her voice. "Hargrove hates being challenged." "I noticed." "No, I mean really hates it. He writes people up for tone. Last month he made a nurse cry because she paged him twice about a fever." Rachel aligned the IV catheters by size before answering. "Did the patient need the page?" "Yes." "Then he made the wrong person cry." Maya stared at her for a second. "Where did you work before this?" Rachel closed the drawer. "Different places." "That's very specific." It was meant to be. Maya was about to push again when Rachel reached for the upper shelf. Her scrub sleeve rode up, exposing the inside of her left forearm. Maya saw the scar. It ran, pale and uneven from wrist toward elbow, jagged at one end, smooth at the other. Not a clean surgical scar. Not a kitchen accident. Not anything that belonged in the normal inventory of a civilian life. Rachel noticed Maya looking and lowered her arm. "What happened?" Maya asked before she could stop herself. Rachel pulled the sleeve back into place. "Old injury." "That doesn't look like an old injury." "It looks exactly like one." "You know what I mean." Rachel met her eyes. Yes, nothing else came. The boundary was not rude. It was simply there, firm as a locked door. Maya looked away first. "Sorry." Rachel picked up 2 IV start kits. "Don't be. Curiosity is normal. Answering is normal too." "Not always." Maya followed her back toward the station, more curious than before and slightly ashamed of it. At 1:42 in the morning, the waiting room had thinned only enough to make every remaining person look more desperate. A woman in a red coat slept upright with her mouth slightly open. 2 college students sat shoulder to shoulder, one holding a towel against the other's hand. A father bounced a feverish baby against his chest while staring at the triage doors like they had personally betrayed him. Rachel stepped into triage when the clerk called for help with a walk-in chest pain. The patient was a woman named Alina Morales, 49, dressed in a grocery store uniform beneath a soaked winter jacket. "It's not chest pain," Alina insisted. "It's pressure. I just worked a double. I'm tired." Rachel guided her into a chair. "Where is the pressure?" "Here." Alina pressed the center of her chest. "But I get heartburn." "Any pain in your jaw?" Alina looked annoyed. "A little. Left arm. Maybe. Nausea." I said, "I'm tired." Rachel placed 2 fingers on the woman's wrist. Her pulse was too fast. Maya appeared with the EKG machine. Rachel did not ask how she knew to bring it. Maya only shrugged. "You looked like you wanted one." Rachel gave the smallest nod. "Good." They placed the leads. The machine printed its thin strip of truth. Rachel read it, then handed it to Maya. Maya's face changed. "I'll get Hargrove. Get Blake, too." Within minutes, Alina was in a monitored bed. Hargrove arrived, irritated, took the strip, and performed competence because competence was expected of him when evidence was already undeniable. "Cath lab," he said. "Activate." Rachel was already placing a second line. Hargrove glanced at her. "You got lucky." Rachel taped the IV. No, she did. He did not like that either. By 2 o'clock, the ER settled into one of those false pauses that only fooled people who had not worked long enough. The kind of pause where no one was actively dying, but every room carried the possibility. A slow drip before the ceiling collapsed. Linda found Rachel near the linen cart, stacking warm blankets in clean folds. "You don't gossip," Linda said. Rachel looked over. "No." "You don't complain." "No." "You restock without being asked. When supplies run out, people waste time." Linda folded her arms. "You chart like a federal investigator's waiting behind you." Rachel placed another blanket on the stack. "Someone usually is, eventually." Linda studied her. "Military." Rachel's hands did not pause. "Why?" "You make hospital corners on trauma blankets. That could be a personal flaw. You also watch doors before people walk through them." Rachel looked at her then. Linda's face was hard but not unkind. "I've worked with veterans," Linda said. "Some of them carry quiet like a shield. Some carry it like a weapon." Rachel picked up 2 blankets. "Which one do I carry?" "I haven't decided. Let me know when you do." Linda snorted. "You ever work trauma?" "Yes." "Here?" "No. Big city." Rachel looked down the hallway where Maya was helping a patient sip water. "Not exactly." "That is not an answer. It is the safest one." Linda took that in. For the first time, her expression shifted from suspicion to something more careful. "Safe for who?" Rachel did not answer. A shout erupted from bed 6. The withdrawal patient had thrown his blanket onto the floor and was trying to climb over the side rail with shaking limbs. Rachel moved before Linda gave the order. His name was Marcus Vale, 31, drenched in sweat, eyes bright with panic and rage. He swatted at the air when Rachel came in. "Don't touch me." Rachel stopped just outside his reach. "I won't unless I need to. You people think you're better than me. No. Yes, you do. I can see it." Rachel picked up the blanket from the floor and placed it over the end of the bed, not on him. "I think you're hurting." His mouth twisted. "Everybody hurts. Not like this." He stared at her. The fight in his face cracked just enough for shame to show through. "Don't do that." "What?" "Talk like I'm still a person." Rachel stepped closer and checked the IV line without touching his skin. "You are still a person." Marcus looked away fast, as if the words had struck something bruised. His hand trembled against the sheet. Rachel lowered her voice. "I'm going to give the medication. It will not fix everything. It may help your body stop shouting for a while." He swallowed. "Will I sleep?" "Maybe." "Will I wake up angry?" "Probably." A broken laugh escaped him. "At least you don't lie. Number." She administered the medication, adjusted his blanket only after he gave the smallest nod, and left the room when his breathing began to slow. Maya watched from the hall. "He cursed at me for 10 minutes earlier." Rachel peeled off her gloves. "He still might." "What did you say to him?" "The truth." "You make that sound easy." Rachel looked toward Marcus's curtain. "It usually costs more than lying." The words stayed with Maya long after Rachel had moved on. At the physician's station, Hargrove dictated a note in a voice too sharp to be fatigue. "Patient presented with vague symptoms," he said into the recorder. "Evaluation conducted promptly. Appropriate escalation initiated." Maya glanced toward Rachel, wondering if she had heard. Rachel had. She did not react. Owen Blake approached with a chart tucked under his arm. "Dr. Hargrove wants you to repeat vitals on 9. Rachel took the chart. "Did he examine him?" Owen hesitated. "He said labs first." Rachel looked down at the numbers. "White count elevated. Heart rate climbing. Temperature now low grade. He needs imaging." Owen lowered his voice. "I know." Rachel looked at him. "Then say it." He gave a tired, bitter smile. "You make that sound easy. You're the second person to say that tonight." Hargrove doesn't like residents pushing him either. Patients do not improve because we are afraid of being disliked. Owen looked away, jaw tight. "I'll talk to him." Rachel handed the chart back. "Talk quickly." Owen left. Maya stepped closer. "You collect enemies fast." Rachel checked the board. "No, some people volunteer." Maya laughed despite herself, then looked toward Hargrove. "You really think Daniel Price has appendicitis? I think he has a surgical abdomen until proven otherwise." And if Hargrove keeps waiting. Rachel did not answer immediately. Her eyes moved across the department again. Bed 12 stable. Bed 6 sedating. Chest pain transferred, triage backed up, 2 ambulances marked incoming but non-critical. Security by the entrance. Linda on the phone with bed control fighting for an ICU bed that probably did not exist. "I keep him alive long enough for someone to stop waiting," Rachel said. Maya was quiet for a moment. "Is that what nursing is to you?" Rachel looked at her. "Sometimes." "What is it the rest of the time?" Rachel's face softened almost imperceptibly. "Witnessing." Maya did not understand all of what that meant, but she felt the weight of it. Near 210, the storm deepened. Rain hit the windows harder, blown sideways by wind off the bay. The ambulance doors rattled. The lights flickered once, just enough for everyone in the ER to look up, then pretend they had not. Linda swore into the phone. "No, I do not care that the floor is short. My patient cannot live in hallway B because staffing ratios hurt your feelings." Rachel walked past with a fresh bag of saline. Hargrove stepped out from the physician room, rubbing his temple as if the whole department had been designed to inconvenience him. "Why is bed 9 still on my board?" Rachel stopped. "Because he is still in pain. I ordered labs. They came back. I saw them. Then you saw they support escalation." Hargrove turned slowly. "You have a remarkable talent for standing where you are not needed." Rachel held the saline bag against her side. "The patient disagrees. Did he request you personally?" "Number." Then spare me the theater. Maya felt heat rise in her face, but Rachel remained still. Hargrove stepped closer. You think because you are quiet, people will mistake you for controlled. But I see this type. Military spouse, maybe. Former medic assistant. Someone who has been near authority and confused proximity with expertise. Rachel's eyes did not move. I never confuse proximity with expertise. Good. Then remember this. In this hospital, your badge tells me what you are. Rachel looked down at the badge, then back at him. That is what badges are for. And yours says RN. Yes, then behave like one. For the first time all night, something changed behind Rachel's eyes. Not anger. Memory. It passed so quickly, Maya almost missed it. Rachel said, I am. Hargrove stared at her, irritated by the lack of apology. Before he could answer, a clerk called from the front desk. Dr. Hargrove, EMS update, coming through on line 2 for transfer status. He turned away sharply. Rachel watched him go. Maya stepped beside her. You okay? Yes. You always say that. It is often true, and when it isn't. Rachel looked toward the ambulance bay doors. The wind shook them again. When it isn't, I still have work to do. She walked back toward the bed 9. Daniel Price was curled slightly now, jaw clenched, forehead damp. Rachel checked his vitals. His pulse had climbed again. He opened one eye. You win. I wasn't competing. Feels like you were. With your appendix, maybe. He gave a weak laugh, then groaned. Can you tell the doctor I'm not being dramatic? I already did. And Rachel adjusted the monitor lead. He's working on believing me. Daniel closed his eyes. That bad, huh? Rachel leaned closer. Listen to me. If the pain changes, if you feel lightheaded, if you feel like something tears or releases you, press that call button. You do not wait because you think waiting makes you tough. He opened his eyes again. You talk to everybody like you outrank them. Rachel's expression remained unreadable. No. Could have fooled me. She stood. Press the button. As she left the room, Owen Blake approached quickly. I got Hargrove to order CT. Rachel gave one small nod. Good. Owen rubbed a hand over his face. He said he was already going to. Of course. Owen looked at her. You don't care who gets credit. Rachel paused. Does credit improve perfusion? He almost laughed, then realized she was serious. No. Then, no. The red EMS phone mounted near the charge desk rang once. Sharp. Different. Every head near the station turned. Linda reached for it. Rachel was closer. She lifted the receiver with one smooth motion. St. Adrian emergency. This is Cole. She listened. Maya saw the change immediately. Rachel's shoulders did not tighten. Her voice did not rise. But the air around her seemed to narrow as if every unnecessary thing had been cut away. Copy, Rachel said. Age. A pause. Mechanism. Another pause. Her eyes fixed on the far wall. Pressure. Maya set down her coffee without realizing it. Rachel's voice became flatter. Repeat that. Linda stepped closer. Hargrove looked over from the physician station annoyed before he knew why. Rachel listened for 3 more seconds. ETA. She looked toward Trauma Bay 3. Under 7, Trauma 3, blood on arrival. Notify surgery. She hung up. The ER seemed to hold its breath. Rachel turned to Linda. Critical inbound from I-95. Male, 34. Army Ranger, rollover with driver side intrusion. Trapped 35 minutes. Penetrating injury to left chest and upper abdomen. Hypotensive. Tachycardic. Diminished left breath sounds. Altered mental status. Linda's face hardened into command. Maya, fluid warmer. Owen airway cart and ultrasound. Call blood bank for O negative. Respiratory to trauma 3. Hargrove strode toward them. Who activated trauma? Rachel met his eyes. I did. His jaw tightened. I decide that. Rachel did not look away. Blood pressure 78/40. Pulse 136. Penetrating thoracic trauma 7 minutes out. For once, he had no immediate answer. The ambulance bay doors rattled again under the storm. Somewhere beyond them, sirens began to rise through the rain. The sirens came through the rain like something wounded and furious. At first, they were only a thin sound beyond the walls buried under wind and the steady noise of the emergency department. Then they grew louder, bending around the hospital, rising hard through the storm, until every person near the ambulance bay turned without being told. Rachel was already in Trauma 3. The room looked clean for exactly 6 seconds. Fresh sheet on the gurney. Suction tested. Oxygen ready. Airway drawer open. Chest tube tray unwrapped. Rapid infuser primed. Warm blankets stacked at the foot of the bed. A basin waited under the left side of the mattress because Rachel had already pictured where the blood would go. Maya came in carrying warmed saline and a box of large-bore IV catheters. "You said 7 minutes," Maya said breathless. "EMS says 7. Weather says less." Maya looked at her. "That doesn't make sense." Rachel checked the suction tubing one more time. Drivers push harder when they think the patient won't make it. Maya swallowed. From the hallway, Linda's voice cut through the department. "Blood bank is moving. Respiratory is inbound. Owen, where is my ultrasound?" "Coming," Owen called. He entered with the portable ultrasound awkwardly tucked against his hip, a roll of probe covers under one arm, and the look of a man trying to outrun his own uncertainty. Rachel glanced at him. "Put it left of the bed. Plug it in now." Owen paused. Hargrove stepped in behind him. "Dr. Blake knows how to set up an ultrasound, Nurse Cole." Rachel did not look at Hargrove. "The outlet on that wall is dead." Owen looked at the outlet, then at Rachel, then moved the machine to the other side. Hargrove's eyes narrowed. "You check the outlets." Rachel opened a sterile pack. "Things fail when you need them most." "That sounds dramatic." "It sounds like experience." Maya froze for half a second, waiting for Hargrove to strike back. He smiled instead, thin and controlled. "Experience is useful when it stays in its lane." Rachel laid towels along the left side of the bed. "Then we should hope everyone has one." The siren cut off outside. That silence was worse. For one suspended breath, the ER heard only rain striking the ambulance bay roof. Then the doors slammed open. Cold air rushed in, first sharp and wet. Then came the stretcher. 2 paramedics pushed hard boots squeaking on the floor jackets, soaked dark faces set in the brutal concentration of people who had been losing a fight for too long. The patient on the stretcher looked less like a man than a battlefield brought indoors. His uniform blouse had been cut open from collar to waist. What remained of the camouflage fabric was black with rain and blood. His skin was gray beneath the dirt. A ragged wound tore across the left side of his lower chest and disappeared toward the upper abdomen under a heap of field dressings already soaked through. Every breath came shallow and wet. A cervical collar locked his jaw in place. Blood streaked his cheek. His right hand hung over the side of the stretcher, fingers, loose knuckles split. The lead paramedic shouted over the rattling wheels. "Staff Sergeant Caleb Reeves, 34, United States Army Ranger." Single vehicle rollover became a secondary pileup on I-95 northbound. Driver side intrusion. Pinned approximately 35 minutes. Severe blood loss on scene. Penetrating injury left thorax and upper abdomen from metal frame debris. We cut the exposed piece for extrication. Pressure falling despite fluids. He's altered, barely responsive. Transfer on my count, Hargrove said, stepping into position at the head of the bed. 1, 2, 3. They moved Caleb onto the trauma bed. His body hit the mattress with a heavy, wrong stillness. Respiratory sealed a mask over his face. Maya moved to the right arm, searching for access through rain-cold skin and collapsed veins. Linda snapped a blood pressure cuff around his upper arm. Owen placed monitor leads with hands that worked quickly but not smoothly. Rachel stood near the left shoulder line. She did not look at the wound first. She looked at Caleb's neck. The veins stood out too much. Not strong, not full with life. Trapped. His pulse showed on the monitor, fast and narrow. 138. His pressure flashed. 76/38. Linda called it out. Pressure 76/38. Hargrove leaned over the airway. Can you hear me, Sergeant Reeves? Caleb's eyelids fluttered. No answer. Airway, patent for now, respiratory said. He's tiring. Breath sounds, Hargrove ordered. Owen listened high on the right, then high on the left. His brow tightened. He moved lower. Decreased on the left. Maybe absent at the base. Chest tube, Hargrove said immediately. Left side. Rachel's eyes remained on Caleb's neck. Doctor. Hargrove did not turn. Not now. Look at his neck veins. Chest trauma with decreased breath sounds, Hargrove said. We decompress. Rachel stepped half an inch closer. His heart sounds need to be checked. Hargrove looked at her, then irritation sharpened his face. Back away from the bed. Maya found a vein and slid the catheter in. I have access. Run warm fluids, Hargrove said. Rachel's voice stayed level. Fluids will not fix obstructive shock. Owen looked up. The words entered the room like cold air. Hargrove's jaw shifted. Do not diagnose over me. Rachel did not raise her voice. Penetrating chest trauma. Hypotension. Distended neck veins. Check the heart sounds. Owen hesitated. Then he moved his stethoscope to Caleb's chest. Hargrove snapped Blake. Owen listened anyway. A second passed. Then another. They're muffled, Owen said quietly. I think they're muffled. Hargrove gave a short laugh with no humor in it. Everything sounds muffled in a trauma bay during a storm. Rachel looked at Caleb's lips. A faint blue tinge had begun there. He is tamponating. Maya's hands paused over the IV tubing. Linda looked from Rachel to Hargrove, then to the monitor. Caleb's pressure dropped again. 72/36. Respiratory adjusted the mask. Sats 89 and falling. Hargrove held out his hand. Scalpel. Owen passed it. Rachel watched Hargrove prep the left chest. Too fast. Not careless, exactly, but already committed. He had chosen the answer before the question finished asking itself. If you put in a tube before relieving the pericardium, Rachel said you may drain blood and still lose him. Hargrove did not look at her. Thank you for the lecture. It is not a lecture. What is it? A warning. He cut. Dark blood came immediately thick and heavy. Suction hissed. Owen helped guide the tube. Maya pressed gauze into place as more blood poured into the basin. For 1 second, the room seemed to accept the blood as proof that Hargrove had been right. Then the monitor told the truth. Heart rate 144. Pressure 68/34. Caleb's chest barely rose. Linda's voice dropped. He's worse. Hargrove's face flickered just once. Then the mask returned. Prepare for intubation. Etomidate, succinylcholine. Rachel moved before Maya reached for the medication drawer. He will crash if you sedate him. Hargrove turned on her. Enough. Caleb's eyes opened. Only a slit. They were blue, glassy, unfocused. For 1 second, his gaze drifted past Hargrove, past Owen, past the lights. Then it found Rachel. Not recognition, not understanding, only instinct. Some part of him found the stillest thing in the room. Rachel leaned closer. Stay with us, Sergeant. His lips moved beneath the mask. No sound came. The monitor changed. The narrow rhythm scattered into chaos. Ventricular fibrillation. Maya whispered, no. Start compressions, Hargrove said. Charge to 200. Owen climbed onto the step stool and began compressions. Caleb's body rocked under the force. Blood seeped faster from the chest tube site. Maya backed away just enough for the defibrillator pads. Charged, she said. Clear. Everyone lifted hands. Caleb's body jolted. The monitor fluttered, then returned to jagged violence. Again, Hargrove ordered. Rachel watched the sternum move under Owen's hands. She watched blood fill places it should not. She watched the neck veins remain wrong. Compressions will not fix this, she said. Hargrove ignored her. Charge again. Charged. Clear. Another shock. For a moment, there was motion. Then the line collapsed into a flat green path across the screen. One long tone filled trauma 3. A systole. No pulse. No rhythm. No argument left from the machine. Maya's hand froze over the medication tray. Linda stared at the monitor with her fingers still on Caleb's carotid. Owen stopped for half a breath, sweat on his forehead, palms red from compressions. Hargrove inhaled to reclaim the room. Resume CPR. Rachel stepped forward. No. Owen's hands hovered over Caleb's chest. Hargrove's head snapped toward her. What did you say? Rachel placed one hand lightly on Owen's shoulder, not pushing him away, only stopping the next useless compression. No. Hargrove's voice rose. Get your hands off my resident and resume compressions. Rachel did not move. His heart cannot fill. You can compress his sternum all night. The blood around the heart will still kill him. He is already dead, Hargrove said. Yes? The word landed hard. Rachel looked at the scalpel tray. That is why the rulebook no longer has time to save him. Maya stared at her. Linda's eyes narrowed not in fear now, but recognition. She had seen nurses freeze break, scream and pray. She had seen doctors perform confidence while patients disappeared under their hands. She had not seen Rachel's kind of calm often. Hargrove pointed toward the door. Security. One of the paramedics looked up from packing away equipment, uncertain whether he had heard correctly. Hargrove shouted louder. Security now. Rachel extended her hand. Scalpel. No one moved. The flatline continued. A cruel, clean tone. Maya looked at Hargrove, then at Caleb, then at Rachel's open hand. Her whole career seemed to rise in front of her like a locked gate. Scope of practice. Hospital policy. Criminal charges. Board review. Termination. Everything official had a voice in her head. But Caleb Reeves had no pulse, and Rachel's hand did not shake. Maya took the scalpel from the tray and placed it in her palm. Hargrove surged forward. Absolutely not. Rachel looked at him. If I do nothing, he stays dead. Then she cut. The incision was clean. Left anterolateral chest. Skin opened. Subcutaneous tissue parted. A second pass deepened the line. Blood welled dark and fast. Maya forgot to breathe. Owen stepped back white-faced. Linda moved to the foot of the bed and locked the wheels without being asked. Hargrove stood at the side, caught between rage and disbelief. This is assault, he said. Rachel changed instruments. Retractor. Maya's hands shook as she passed it. Rachel placed it between the ribs and opened the chest. The sound that moved through the room was not a scream. It was worse. A collective intake of breath from people forced to see the body become honest. Rachel reached for suction. Maya. Maya snapped back. Suction on. The machine whined alive. Rachel cleared the field in 2 precise passes. Blood vanished into tubing. The wound opened into anatomy terrible and intimate under the white trauma lights. There, Rachel murmured. Maya saw only glistening tissue and blood. Rachel saw the problem. The pericardium bulged tight and dark, swollen with trapped blood around a heart that had no room to beat. Owen whispered, "My God." Rachel lifted the pericardium with forceps. Small incision. Hargrove's voice broke through. "You are not credentialed to do this." Rachel did not look up. "He is not credentialed to die because you were embarrassed." She cut. Blood rushed out of the pericardial sac. The pressure changed instantly. No machine announced it. No alarm confirmed it. But everyone in the room felt it the way a locked door feels different the moment it opens. Under Rachel's fingers, Caleb's heart twitched. Maya made a sound like a sob. It moved. Rachel slid her hand around the heart with impossible familiarity. "It's trying." She began internal cardiac massage. Not frantic. Rhythmic. Purposeful. Her hand compressed and released, guiding the muscle coaxing motion from tissue that had almost surrendered. "Epinephrine," she said. Maya moved. The order gave her something to hold on to. She drew the medication, found the port pushed. Epi in. Owen stared at the monitor. Still a systole. Rachel kept working. "Give it a second." Hargrove found his voice again. "Time of death, 2:24. Linda turned so fast her badge slapped against her scrub top. No. The word filled the room. Hargrove looked at her as if she had betrayed a country. Linda stepped closer to the bed. Not while she has his heart in her hand. The flatline broke. One beep, then another. A small, narrow complex crawled across the monitor. Owen's mouth opened. I have electrical activity. Linda reached for the carotid again. Her fingers pressed into Caleb's neck. For a moment, nothing. Then she looked up. I have a pulse. Maya put one hand on the cart because her knees nearly failed. Respiratory exhaled hard. The paramedic at the door whispered something that might have been a prayer. Rachel did not celebrate. She changed her hand position inside the chest. Owen leaned forward despite himself. What are you doing? Maintaining perfusion. That's the descending aorta. Yes. Rachel compressed by feel. The pressure on the screen climbed. 60 systolic. Then 72. Then 84. Linda called numbers like she did not fully believe them. 86/40. Rachel's face was streaked with blood. One line had reached her jaw. Her eyes remained steady. Blood. Maya grabbed the first unit as it arrived. Here. Warm it, spike it, now. Maya obeyed. Hargrove stood near the bed, pale beneath the lights. The room no longer belonged to him. That was the part he could not survive. You had no right, he said. Rachel looked up at him then. Only for a second. I had a dead soldier. The word struck harder than anger. Owen checked the monitor again. Pressure holding at 90 systolic. Rachel nodded. Not for long. He is still bleeding. Likely cardiac injury, possible abdominal extension. Linda reached for the red phone. OR. Now, Rachel said. Tell them, open chest penetrating thoraco-abdominal trauma, return of spontaneous circulation after tamponade release. Massive transfusion protocol. Linda repeated it into the phone with the clipped precision of someone who knew every word could shave seconds off death. Maya worked beside Rachel blood bag, lifted high tubing, clear hand steadier now because terror had been given a task. Owen moved to the airway. He's not protecting. Rachel kept her hand inside Caleb's chest. Prepare to intubate with minimal hemodynamic disruption. Do not let him buck. Tell anesthesia he is unstable and open. Owen looked at Hargrove out of reflex. Hargrove said nothing. Rachel said Owen. He looked back at her. Yes, that was all. He moved. The hallway outside Trauma 3 had gathered witnesses. 2 nurses, a tech, 1 security guard, a respiratory therapist who had arrived halfway through and had not left. None of them spoke. Linda hung up the phone. They're clearing OR2. Good, Rachel said. We move now. Hargrove stepped forward as if remembering his own body. This patient cannot leave this bay like that. Rachel looked at the monitor. He cannot stay here and live. We need documentation. Linda barked. Documentation can chase us upstairs. Rachel adjusted the packing around the wound. More lap pads. Maya passed them. Blood soaked through almost immediately. Rachel pressed deeper, careful and exact. Caleb's pressure wavered. 88. 82. 90. Not safe. Only possible. The kind of possible people mistake for hope, because they need a name for the small space between catastrophe and loss. Unlock the bed, Rachel said. Linda kicked the lock free. Owen secured the airway equipment for transport. Maya gathered the bloodlines and meds. Respiratory moved with the bag valve mask eyes fixed on chest rise. The bed lurched forward. Rachel moved with it, one hand still inside Caleb's open chest body, braced against the rail. The corridor opened around them. People flattened against walls. A janitor pulled her cart backward so fast the mop bucket sloshed over. A visitor near the vending machine stared face empty with shock. Somewhere, a child asked why the man was bleeding. No one answered. The transport monitor beeped in a fragile rhythm. Rain hammered the windows as they passed. Rachel did not look away from Caleb. Maya walked beside her, holding blood high, keeping the line untangled. She glanced once at Rachel's hand disappearing into the open chest, and with a cold certainty that moved through her whole body, Maya understood something she had not understood in Trauma 3. Rachel Cole was not guessing. She was not brave because she had no fear. She was brave because this was familiar. The elevator doors opened. They packed inside with impossible care. Linda, Maya. Owen. Respiratory. Rachel Caleb. Blood tubing monitor breath. Pressure silence. Hargrove squeezed in last standing near the doors, like a man trapped inside the proof of his own failure. The elevator rose. No one spoke. The machine beeped. Rachel's hand kept time with the heart beneath her palm. At the surgical floor, the doors opened on bright lights and waiting faces. The OR team stood ready, but their expressions changed when they saw the open chest. A scrub nurse with gray hair and 30 years in her posture recovered first. "Bring him in." An anesthesiologist stepped forward. "Who did the thoracotomy?" Rachel answered without slowing. "I did." He looked at her badge, then at her hand inside the patient's chest. Whatever he thought, he swallowed it. "Then keep doing exactly what you're doing." They rolled Caleb into OR2. The overhead lights flooded his body white. Steel instruments waited in rows. The smell changed from ER blood and rain to cautery sterile drape and cold discipline. A new man entered while tying his gown. Dr. Samuel Keene, late 50s, broad-shouldered, silver at the temples, eyes tired but sharp enough to cut. He took one look at the wound, the packing, the monitor, Rachel's hand position, and the pressure barely holding. Then he looked at Rachel. "Report." Rachel did not waste a word. 34-year-old male. Penetrating injury left thorax into upper abdomen after rollover with entrapment. Profound hypotension on arrival. Distended neck veins muffled heart sounds, chest tube failed to correct hemodynamics. Arrested in trauma 3. Left thoracotomy, pericardial tamponade relieved internal cardiac massage achieved pulse. Manual aortic compression ongoing. Suspected right ventricular injury and intra-abdominal bleeding. Keene stepped closer. His eyes narrowed. Not in doubt. In recognition. "Hold there." Rachel held. Keene leaned in, studying the field. "Good." One quiet word. Maya heard it from the wall. So did Hargrove. And in that single word, the night shifted again. "Good." The word was small, almost lost beneath the suction and the rhythm of the ventilator, but it struck the operating room harder than praise. Rachel did not look up. She kept her hand exactly where it was, fingers locked in the narrow space between life and collapse. Caleb Reeves' heart beat against her palm with a weak, stubborn flutter. It was not strong. It was not steady. It was only there. In rooms like this, there was a world of difference between gone and there. Dr. Samuel Keene stepped into the field like a man entering a storm he had known since youth. He did not waste time on shock. He did not waste time on questions that did not change the bleeding. His eyes moved over Caleb's open chest, the packing, the line of injury, the monitor, the pressure, Rachel's hand. Anesthesia. Where are we? Pressure, 84 systolic with manual compression. Heart rate, 120. Oxygenation marginal but holding. We're pushing blood now. How much inches? 2 units started, more on the way. Keene nodded once. Massive transfusion. Get plasma and platelets up here. Warm everything. The anesthesiologist had already turned toward the phone. Keene looked at Owen Blake, who stood near the edge of the room in blood-stained scrubs, pale and shaken. "You, resident." Owen straightened too fast. "Yes, sir." "Hold retraction when I tell you. Do not guess. Do not drift. Do not move unless I say move." "Yes, sir." Keene looked at Maya. "You have steady hands." Maya almost answered no. Rachel spoke first. "She does." Maya swallowed. Keene's eyes flicked to her. "Then stay where she can reach you." Maya nodded and stepped closer to Rachel's side. Miles Hargrove stood near the OR doors, still wearing gloves, still wearing his white coat as if refusing to shed the costume would somehow preserve the role. Blood marked one sleeve, one small fleck. Nothing like Rachel, whose scrubs were soaked across the front and streaked along the arms. Hargrove cleared his throat. "Samuel. I need to make clear that this procedure was initiated without authorization in the emergency department." Keene did not look at him. "You can make it clear later. This is not a small matter." "No, Keene," said eyes on the wound. "It is a dying man." Hargrove's face tightened. I was managing the trauma according to protocol. Keen reached for suction. You were managing your comfort. The room went quieter around that sentence. Rachel felt Caleb's pressure dip before the monitor showed it. He's dropping. Anesthesia called it a breath later. 76 systolic. Keen moved in. More suction. Maya handed it over. Blood pooled again, dark and relentless. Keen cleared the field, found the pericardial opening Rachel had made, then tracked the injury with the speed of a man reading a map written in red. Right ventricle, he said. Rachel's answer came low. Yes. Keen did not ask how she knew. He placed one gloved hand near hers. I'm taking control on my count. Rachel nodded. Ready. 1. Maya held her breath. 2. The monitor gave a thin alarm. 3. Rachel shifted half an inch. Keen's hand replaced the exact pressure she had maintained. For one terrifying second, Caleb's numbers wavered. Then they held. Keen's eyes moved to Rachel again. Good hands. Rachel stepped back just enough to let him work, but not far enough to leave. The sudden absence of Caleb's heart in her palm moved through her body like cold water. Her fingers cramped. Her forearm trembled once before she closed her hand into a fist and stopped it. Maya saw. Rachel saw that Maya saw. Neither said anything. Keen worked fast. Needle, suture, suction, clamp, sponge, pressure. His movements had no drama in them, only discipline. The room narrowed into essential words. More light. Clamp. Hold that. Suction. Pressure. 82. Another unit. Here. Abdomen is still firm. Keen looked down the wound tract. Get general surgery in here now. A scrub nurse said Dr. Patel is coming. Tell Patel to run. Maya stood close enough to pass what Rachel needed and far enough to stay out of Keen's way. Her heart had not stopped pounding since the flatline. Every time she looked at Caleb's face beneath the drape, she saw him as he had been in Trauma 3, gray and empty, gone from the world except for the stubborn refusal in Rachel's eyes. Owen held retraction with both hands. Sweat rolled from his temple beneath the cap. He did not wipe it. He did not dare. Keen placed another stitch. Better. Anesthesia called pressure 90 systolic. Do not trust it, Keen said. He has more bleeding. Rachel stepped toward the lower field. Upper abdomen. Keen gave her a brief glance. You think the fragment tracked through the diaphragm? I think it did more than track. Keen looked at the injury again. So do I. Hargrove let out a sharp breath. Are we now taking operative direction from her? Keen finally turned. Only his head moved. The rest of him stayed over Caleb. Dr. Hargrove, either scrub in and become useful or leave my operating room. The anesthesiologist stopped moving for half a second. Owen looked down. Maya stared at the floor because looking at Hargrove felt dangerous. Hargrove's mouth opened. No sentence came out that could survive the room. He stepped back. The doors opened, and Dr. Anika Patel came in with her mask half-tied and her eyes already on the field. What do we have? Keen answered. Penetrating thoracoabdominal trauma. Ventricular injury controlled. Ongoing hemorrhage below. He arrested in the ER and came back after tamponade release. Patel looked at Rachel, who opened him. Rachel said, I did. Patel took in the badge. Rachel Cole, RN. Then she looked at the way the room was arranged around Rachel, the way Keen did not question her, the way Owen and Maya kept glancing toward her, as if she was a second monitor. Patel said only, all right. She scrubbed in. The next hour did not pass like time. It passed like impact. Caleb bled. They replaced what they could. Blood moved from bags into tubing, from tubing into veins, from veins into a body trying to decide whether to stay. Keen repaired the ventricular wound. Patel opened the abdomen and found the damage there, the torn vessels, the bruised organs, the path of metal violence that had entered one side of Caleb and tried to write its ending inside him. Rachel remained near the wall once Keen no longer needed her hands. She should have stepped out. She did not. Maya stood beside her, face pale under the OR cap. You okay? Maya whispered. Rachel did not look away from the table. Yes? Maya's voice was raw. You always say that. Rachel flexed her left hand once slowly. This time, I mean, he is not dead. Maya looked at her. There was blood drying along Rachel's jaw. A thin red line curved near her collarbone. Her eyes were steady, but something deep behind them had moved closer to the surface. Maya lowered her voice. Where did you learn to do that? Rachel's gaze stayed on Caleb. In places where waiting was another way to bury people. Maya did not know what to say to that. On the table, Keene tied off another bleeder. Pressure, 96 systolic. Urine output, starting. Patel exhaled. Liver is bruised but not shattered. Bleeding controlled here. Keene checked the repair again. Cardiac repair holding. Anesthesia said rhythm sinus. Weak but sinus. The room did not celebrate. ORs did not celebrate too early. They adjusted, checked, counted, confirmed, doubted, and survived the next 5 minutes. Then the next. Then the next. At last, Keene stepped back. Pack and temporary closure. ICU after stabilization. The words moved through the room like the first clean breath after smoke. Caleb Reeves was alive. Not safe. Not saved in the way families imagine saved, but alive. That was enough to force the night to keep accounting for him. Rachel turned toward the scrub sink outside the OR. Her legs felt distant from the rest of her body. She removed her gloves carefully. Blood had seeped beneath the cuffs. It marked the creases around her nails and dried in the small cuts along her knuckles. Maya followed her out. The hallway beyond the operating room was too quiet. After the violence of the trauma bay and the controlled war of surgery, the silence felt wrong. Hospital quiet was never empty. It held machines, footsteps, distant pages, the murmur of grief behind closed doors. Rachel stood at the sink and scrubbed. Hot water. Soap. Fingertips. Nails. Knuckles. Wrists. The water ran pink, then pale, then clear. Still, blood remained in places. Maya watched her. You brought him back. Rachel did not stop washing. He was not ready to stay. That is not what I said. Rachel turned off the water. The automatic faucet clicked into silence. Maya handed her a towel. For a second, Rachel only looked at it as if the motion required translation. Then she took it. The OR doors opened behind them. Keene stepped out, removing his cap. He is going to ICU, he said. Critical. Intubated. Open abdomen. Chest temporarily closed. But he has a pressure and a rhythm. Maya's shoulders dropped. Rachel nodded once. Good. Keene studied her face. You going to tell me who you are? Rachel dried her hands. You already read the badge? I read a badge that lied by omission. Rachel looked at him then. Keene's eyes were not hostile. They were not gentle either. They were the eyes of a surgeon who knew the shape of trained hands. You performed a resuscitative thoracotomy in a civilian ER with no hesitation, he said. You relieved tamponade, performed internal massage, compressed the aorta, and transported with manual control. That is not a weekend course. Rachel folded the towel once. Number. Maya's breath caught. Keene waited. Rachel said nothing else. Before he could press, the elevator doors opened at the far end of the hallway. Linda Mercer stepped out with Peter Langford, the hospital administrator, and 2 Providence police officers. Langford looked like he had been pulled from sleep and ironed badly. His pale dress shirt was damp at the collar. His tie was crooked. His eyes were wide with the particular fear of a man who had just heard the word liability in 3 different phone calls. Behind him walked Officer Nora Hayes and Officer Daniel Price. No relation to Bed 9, both in dark rain jackets with police patches shining wet under the lights. Hargrove came out of the scrub area behind them, freshly washed, his face composed into injury. There she is, he said. The words made Maya's stomach tighten. Langford stepped forward. Ms. Cole. Rachel faced him. Administrator Langford. I need you to remain here. I am here. Hargrove's voice sharpened. You physically interfered with the physician-led resuscitation, stopped compressions, performed an unauthorized invasive procedure, and transported a patient with an open chest through public corridors. Maya stepped forward. He was dead. Hargrove turned on her. "Do not interrupt." Maya flinched, but she did not step back. "He was dead," she repeated. And she got a pulse. Officer Hayes raised one hand, calm but firm. "I need everyone to slow down." She was in her late 30s with dark hair pinned tight and the level eyes of someone who had spent years learning that the loudest person was rarely the most honest. She looked at Rachel. "Ma'am, are you licensed medical staff at this hospital?" Rachel said, "I am employed here as a registered nurse." Hargrove almost laughed. "Employed under false pretenses, apparently." Keene's voice cut in. "The patient is alive because of her." Langford pressed 2 fingers to his temple. "That does not erase credentialing Dr. Keene." "No," Keene said. "It does not erase what happened before she acted either." Hargrove went still. Langford looked between them. "What does that mean?" Keene's expression hardened. "It means Dr. Hargrove missed tamponade in a penetrating chest trauma patient presenting with hypotension, distended neck veins, and muffled heart sounds. It means the patient arrested while he continued down the wrong pathway. It means Rachel Cole performed the only intervention that gave that man a chance to reach my table." Hargrove flushed. "That is a grotesque simplification." "It is a surgical summary," Keene said. Officer Hayes looked at Rachel's blood-stained scrubs, then at Keene, then at Hargrove. "Is the patient alive right now?" "Yes," Keene said. "Critical?" "Yes." "But alive?" "Yes." Hargrove stepped closer. "That is not the point. The point is that a nurse cannot open a patient's chest because she disagrees with a doctor." Rachel's voice was quiet. "I did not disagree with you." Hargrove stared. Rachel held his gaze. "I disagreed with death." No one spoke for a moment. Then Langford's phone rang. He looked at the screen and lost more color. "Excuse me." He answered and turned slightly away. "Yes, this is Langford." His expression changed as he listened. "What video?" Maya closed her eyes. Linda muttered something under her breath. Langford looked toward them. "Who filmed inside Trauma 3? No one answered. Officer Hayes looked sharper now. "There is video." Langford lowered the phone. "It is online." The hallway seemed to tilt. Maya pulled out her phone with shaking hands. Linda leaned over her shoulder. Even Hargrove looked at the screen, hungry and afraid at the same time. The video was grainy shot from the waiting room through a gap no one should have had. It showed motion blood, the flash of instruments, Rachel leaning over Caleb's chest, Hargrove shouting Maya, handing something into Rachel's palm. The caption underneath had already been copied and reposted. "Nurse cuts open soldier in Providence ER after doctor loses control." Maya's throat went dry. "That is not what happened." Hargrove looked at the screen and something like opportunity moved behind his eyes. Langford spoke into the phone again. "No comment." I said no comment. Officer Hayes looked at Rachel. "Ms. Cole, until we sort this out, I need a statement from you." Rachel reached into her scrub pocket. Hargrove noticed first. "What is that?" Rachel pulled out a compact black phone. Not a hospital phone, not a personal smartphone. It was matte, unmarked, and built like it expected to be dropped from aircraft. Keene's eyes narrowed. Linda stared. "Maya," whispered Rachel. Rachel dialed from the memory. When she spoke, her voice changed. Not louder, not colder. Command entered it like a blade sliding free. "This is Ward." Maya felt the name strike before she understood it. Rachel continued. "I am compromised. St. Adrian Medical Center, Providence. Army Ranger patient alive. Civilian exposure. Possible hostile follow-through. I need legal containment and security verification." A pause. "Yes. No." She ended the call. Hargrove stared at the phone. "What did you just do?" Rachel put it away. She did not answer. The elevator doors opened again. 4 men stepped out in dark suits, dry despite the storm outside. Their eyes moved once across the hall, measuring exits, faces, threats, and lines of sight. At their center walked a tall man with close-cropped gray hair, a scar along his jaw, and the kind of presence that made even police officers adjust their posture. He approached Rachel. For 1 second, something passed between them that had nothing to do with St. Adrian Medical Center. History. Damage. Trust. He stopped 3 feet away. Major. Maya stopped breathing. Langford's mouth opened. Hargrove said Major. The man turned to Officer Hayes and removed credentials from inside his jacket. Colonel David Rourke, United States Department of Defense. Officer Hayes read the credentials carefully. This is a civilian hospital. Rourke nodded. Not anymore. Langford found his voice. What does that mean? It means your patient upstairs is connected to an active federal matter. Hargrove stepped forward. This is absurd. She is a nurse who violated procedure. Rourke looked at him. Dr. Miles Hargrove. Hargrove stiffened. Yes. Stop talking. The hallway went silent. Rourke placed a second credential folder on the counter near Officer Hayes. Maya saw the photograph first. Rachel's face younger, harder hair, shorter, eyes the same. The name was not Rachel Cole. Major Rachel Ward, M.D. United States Army Medical Corps. Former Forward Surgical Team Commander. Special Operations Trauma Specialist. Maya looked from the card to Rachel. You are a doctor. Rachel's answer was soft. I was. Keene looked at the credential, then back at her. No, you are. Hargrove's face twisted. She has no privileges here. Keene did not look at him. And yet she had the skill you did not. Rourke closed the credential folder. Staff Sergeant Caleb Reeves was not supposed to be in Providence tonight. Rachel's eyes moved to him. Rourke continued. He was transporting evidence tied to a procurement fraud investigation involving military contractors and private security intermediaries. He contacted our office 4 hours ago and said he believed he was being followed. Officer Hayes straightened. Are you saying the crash was intentional? Rourke looked at Rachel. Highway inspection found brake line damage inconsistent with impact. Steering linkage was tampered with before the crash. Maya felt cold move through her chest. Linda said someone tried to kill him. Rourke nodded and failed. Rachel looked toward the ICU elevators. How many people know he survived? No one answered quickly. That was answer enough. The paramedics knew. The ER knew. The OR knew. The waiting room had seen enough. The internet had seen too much. Hargrove had already been speaking to administrators. Langford had already been taking calls. Rachel's jaw tightened. Who is with him? Rourke said hospital security and one of mine are being assigned now. Being assigned. His expression changed. Rachel was already moving. Keene followed. Where are you going? To ICU. Rachel. She stopped at the elevator and looked back. The name sounded strange now in Keene's mouth, too small for what had been revealed. Rourke joined her. Officer Hayes moved too. Langford called after them. We need to control the legal situation. Rachel pressed the elevator button. You control paperwork. The doors opened. Her eyes stayed on the numbers above the frame. I'll control the threat. The elevator doors closed on the 5th floor with a soft metallic sigh, and for a moment the hospital noise disappeared behind them. Rachel stood near the control panel, still in blood-stiffened scrubs, hands half clean, face marked by the night in thin red lines the sink had not erased. Colonel David Rourke stood beside her, one hand inside his jacket, his eyes fixed on the doors as though he expected them to open on trouble. Dr. Samuel Keene filled the rear corner arms tense, jaw locked. Maya pressed herself against the side rail, suddenly aware of every smear of blood on her shoes. Officer Nora Hayes stood closest to the doors. No one spoke for 2 floors. The elevator hummed upward. Rain tapped somewhere far away against upper windows, softer here than in the ER, but still present like the storm had followed them inside and climbed through the walls. Maya looked at Rachel. Not Rachel Cole, Major Rachel Ward. The name sat strangely in her mind, heavy and sharp-edged. She had spent the night beside a woman she thought was simply private, maybe wounded, maybe military adjacent. Now every quiet movement had a different meaning. Every pause, every glance toward a door, every careful hand in a crisis. You were never a nurse, Maya said quietly. Rachel did not turn. I am a nurse tonight. That's not an answer. Number. Maya waited. Rachel looked at the red numbers over the doors. I was a surgeon before I was a ghost. Keen's eyes shifted toward her. Rourke said nothing. Maya swallowed. Why hide here? Rachel's face stayed forward. Because quiet places are easier to survive. The elevator passed the 4th floor. Maya almost laughed, but there was no humor in it. You picked the emergency department. Rachel's mouth moved by the smallest degree. I miscalculated. No one smiled. Rourke reached into his coat and pulled out his phone. He checked the screen typed once, then looked at Rachel. My team is still 3 minutes out from ICU. Rachel's eyes hardened. Too slow. They were deployed to secure the lobby after the video hit. Wrong priority. I know. Keen looked between them. You're seriously telling me someone might walk into my ICU and try to finish killing him? Rachel finally turned. No. Keen's jaw tightened. Rachel continued. I'm telling you someone already planned for the first attempt to fail. The elevator slowed. Officer Hayes drew a breath and rested one hand near her holster. I need something clear before these doors open. If there is a threat, this is still a hospital. Patients on this floor are unconscious, ventilated post-op elderly septic. We cannot turn it into a battlefield. Rachel looked at her. Then don't let the battlefield choose the room. The doors opened. The ICU was dimmer than the ER, but not calmer. It had a different kind of tension. Downstairs, fear shouted and bled and paced. Up here, fear lay under blankets connected to tubing measured in numbers that rose and fell on glowing screens. Machines breathed for people. Pumps clicked medicine into veins. Monitors whispered in rhythm. The lights were low to protect sleep that was not truly sleep. The air smelled of antiseptic warm plastic and something older. Waiting. Rachel stepped out first. Her eyes moved once across the hall. Nurse's station. Medication room. Family waiting area. Supply closet. 2 patient doors open. 3 closed. 1 environmental services cart abandoned near the far corridor. No guard at the elevator. No uniformed security by the stairwell. Her gaze stopped on the glass-walled room halfway down the hall. Caleb Reeves. Ventilator cycling. Chest dressed, lines running, monitor alive. No one outside his door. Rachel's voice changed. Where is security? The ICU nurse at the desk looked up, startled by the sudden arrival of blood-stained people and one man in a dark federal suit. He was just here. Rachel stepped closer. Where? The nurse's eyes moved toward the side hall. A visitor said someone was screaming near linen storage. He went to check. Rourke's face went flat. Officer Hayes whispered bait. Rachel was already moving. Who has entered this unit in the last 10 minutes? The nurse stood too quickly, knocking a pen to the floor. I don't know. Respiratory came through. Pharmacy runner? Transport aide, maybe. Maybe. I thought he was transport. What did he look like? The nurse's voice thinned. Blue scrubs, mask, cap. I didn't see his face. Rachel looked toward Caleb's room. Lock his door. The nurse reached for the control panel with shaking fingers. Keen moved beside her. Do it now. The lock clicked. Inside the room, the ventilator kept moving. Rachel turned to Rourke. Weapon. Officer Hayes snapped number. Rourke reached to his ankle. Keen said this is an ICU. Rachel did not look away from the far stairwell. That's why they chose it. Rourke drew a compact pistol and offered it grip first. Hayes stepped closer, voice low and hard. You cannot arm a civilian in a hospital. Rourke looked at her. She is not a civilian in the way that matters right now. Rachel took the pistol. Magazine check. Chamber check. Safety. One clean movement after another. No flourish, no hesitation. Maya stared. It was the same calm as the scalpel. That made it worse. Rachel tucked the weapon behind her waistband beneath the loose scrub top, then pulled the fabric down over it. Keen's voice came out rough. Who have you been hiding from? Rachel's eyes stayed on the corridor. Not a person. Then what? What people become when fear gets paid. Before Keen could answer, the far stairwell door opened. 2 men stepped into the ICU. Both wore blue hospital scrubs, disposable caps, and surgical masks. One carried a soft black medical equipment bag. The other walked half a step behind him, shoulders loose, eyes moving too smoothly over the hallway. Real hospital staff at 3 in the morning did not move like that. They moved tired, irritated, distracted, heavy with hours. These men moved as if the floor had already been mapped. The ICU nurse whispered, "That's him." Rachel shifted toward the shallow alcove outside an empty room. Her body did not crouch. It simply lost visibility half a step into shadow, one hand behind her back. Rourke moved left. Hayes drew her weapon and used the nurse's station for cover. Maya stood frozen until Keene grabbed her sleeve and pulled her behind the desk. The first man reached Caleb's door and tried the handle. Locked. His head turned slightly. The second man scanned the hall. Rachel stepped out. "Stop." The word cracked through the ICU. The first man froze. The second moved too fast. His right hand went into the black bag. Rachel drew and fired twice. The shots shattered the floor's quiet. The second man dropped hard against the wall, clutching his thigh, the bag falling open beside him. A pistol, wrapped in a towel, slid halfway out. The first man tore a suppressed handgun from beneath his scrub top and fired toward Rachel's muzzle flash. Glass burst from the empty room beside her. Maya hit the floor behind the desk, elbows striking tile. The ICU nurse screamed and ducked low. A monitor in another room began alarming wildly as the patient startled against sedation. Hayes fired once. The gunman jerked back but did not fall. Rourke moved down the left side of the hall, weapon raised, controlled, searching for a clean shot that would not pass through glass into a patient room. Rachel was already gone from where she had fired. The gunman shot again, shredding the doorframe. By then, Rachel had slipped into the empty room and moved through the broken glass and curtain shadow. She came out of the side doorway low and fast, not charging blindly, not rushing for spectacle, but closing distance before the gunman could correct his aim. He saw her too late. Rachel hit him at the waist and shoulder. The weapon kicked upward, firing into the ceiling tiles. White dust and insulation rained down. He slammed against the wall, tried to twist free, but Rachel had his wrist trapped and her weight buried into the turn. He was bigger. It did not help. She took the inside arm, drove his elbow past the line of strength, and put him on the floor with a sound that made Maya flinch. The pistol skidded away. He reached for it. Rachel struck once with the butt of Rourke's pistol, short and brutal. He went still. The wounded attacker on the floor near Caleb's door dragged himself toward the open bag. Blood smeared beneath his leg. His gloved hand reached for something inside. Rachel turned the pistol toward him. "Don't." He kept reaching. Her voice lowered. "Do not." His hand stopped. Hayes moved in weapon steady. "Hands where I can see them." The man lifted both hands slowly, breathing hard through the mask. Rourke kicked the bag away and crouched to open it. Inside were zip ties, fake badges, a second weapon, nitrile gloves, a small hard case with syringes seated in foam. No labels, no pharmacy markings, no reason to be in an ICU except murder. Keene stood from behind the desk, face white with rage. That was for him. Rachel looked through the glass into Caleb's room. The ICU nurse inside had stayed by the bed. She was shaking badly, one hand braced against the rail, but she had not abandoned the patient. Caleb's ventilator continued its steady rise and fall. His monitor beeped. Pressure low, but present. Rhythm alive. Rachel nodded once at the nurse through the glass. Good. The nurse looked like she might cry. The elevator chimed. Every weapon in the hall rose. Hayes shouted, "Hold." The doors opened. 4 Army personnel stepped out, first rifles low but ready, moving with disciplined speed. Behind them came a tall man in a dark overcoat, rein still on his shoulders, hair silver, face drawn tight by a fear too disciplined to show fully. General Thomas Reeves. No one introduced him. The resemblance was there before the name arrived. Caleb's jaw. Caleb's eyes, if they had been open. The same hard line of endurance around the mouth. General Reeves took in the hallway. The broken glass. The downed attackers, the weapons, the blood, the federal agents, the nurse in ruined scrubs holding a pistol. Then his gaze moved through the glass to his son. For the first time, something broke through the command in his face. Not much. Enough. He stepped toward the door. Rachel moved into his path. Not yet. One of the soldiers with him shifted. Rourke lifted a hand, stopping him. General Reeves looked at Rachel. "That is my son." "Yes, sir." "Move." "No, sir." The hallway tightened. Keene looked at Rachel as if she had just chosen the hardest possible sentence in the English language. General Reeves' voice dropped. "Major Ward." Rachel did not react to the name. "He is alive because controlled access is keeping him alive. Until the room is cleared, you do not go in." For a second, the general stared at her with the cold fury of a father being denied one more step toward his child. Then he looked past her again. Caleb's chest rose with the ventilator. Rose. Fell. Rose. The general's hands closed into fists at his sides. "Clear it." Rourke nodded to his men. Two entered Caleb's room first, checking behind the curtain under equipment inside the bathroom near the ceiling panels. One examined the IV lines, another checked the medication pumps and access ports. Hayes secured the wounded attacker. Keene went in after the room was cleared and checked Caleb's numbers himself. Rachel stayed outside the door until Keene looked back and gave one short nod. Only then did she step aside. General Reeves entered slowly. The sight of Caleb up close did what the hallway had not. It aged him. He stood beside the bed looking down at the tubes, the bandages, the swelling, the color that was not good, but was not death. His hand hovered over Caleb's arm for a moment before settling lightly on the sheet instead, as if he feared touching his son might hurt him. The ventilator breathed. The monitor answered. General Reeves spoke without looking away. "Who opened his chest?" No one answered immediately. Rachel stood in the doorway. "I did." The general turned. His eyes moved over her blood-stained scrubs, the pistol now lowered at her side, the scar partly visible along her forearm where the sleeve had torn. "You saved him in the ER. I bought time. And here. I protected the time." The general looked back at Caleb. His voice was quieter. "He called me at midnight." Rachel's eyes shifted. What did he say? That if anything happened to him, I should not trust the first report. Rourke entered the room. "Sir, we need to move him once he is stable enough." Keene answered before the general could. "He is not stable enough." Rourke looked at him. "How long?" Keene's face hardened. "For transport hours at least. Maybe more. He has a repaired ventricle abdominal packing massive transfusion and a body that just lost a war with physics and barely negotiated terms." General Reeves looked at Rachel. "Can he survive here?" Rachel did not answer quickly. She looked at the hallway, the broken glass, the ICU doors, the nurses' station, the elevators, the stairwell, the lines of approach, the soft places, the tired staff, the civilians who had no part in this but were now inside it. "Yes," she said. Rourke turned toward her. "You cannot promise that." Rachel looked at him. "I didn't." General Reeves understood the distinction. His jaw worked once. "What do you need?" Rachel answered like she had been waiting for the question. "Full lockdown of this floor. No staff changes without visual confirmation. No outside medication delivery. Armed security at both stairwells and elevators. Every line going into him checked by Dr. Keene or someone he personally trusts. No press past the lobby. No administrator access unless escorted. And I want the names of everyone who knew his route tonight." Rourke nodded once. "Done." Hayes stepped into the doorway. "And Providence Police is not being pushed out of my own crime scene." Rachel looked at her. "Good." Hayes studied her. "You always give orders to rooms you don't belong in," Rachel said. "Only when the room is already on fire." Hayes almost smiled. Almost. From the hallway, Peter Langford's voice rose near the elevators. "This is completely unacceptable. We have patients, families, liability exposure, and media already outside. I need a full explanation before federal personnel start turning my hospital into a military facility." Linda Mercer's voice answered him. Peter, 2 men just brought guns and poison onto my ICU floor. Pick a better hill. Langford stepped into view, pale and sweating. Behind him, Hargrove appeared. He had not come up with the first group, but he had arrived now, clean scrub top, wet hair, and a phone in his hand. He looked at the shattered glass, the armed personnel, the attackers on the floor, and Rachel standing at Caleb's door. His expression was unreadable for 1 second. Then it arranged itself into blame. "This is exactly what happens when procedure is abandoned," Hargrove said. Maya, who had been standing behind the nurse's station with trembling hands, looked up sharply. Rachel did not respond. Hargrove looked toward General Reeves, choosing his audience with care. "General, I understand this is an emotional situation. But you should know your son's care was compromised by unauthorized action, and now this hospital has been exposed to a security breach because federal actors failed to disclose the nature of the threat." The hallway went quiet in the dangerous way. General Reeves turned slowly. "My son is alive." Hargrove hesitated. "Yes, but was he dead?" Hargrove's jaw tightened. "He arrested. That was not my question." Keene came out of Caleb's room. He was pulseless in a systole. The general kept his eyes on Hargrove. "Was he dead?" Hargrove said nothing. Maya spoke, voice shaking but clear. "Yes." Everyone looked at her. She stood straighter. "He was dead." Dr. Hargrove called time of death. Rachel had her hand inside his chest when his pulse came back. Hargrove snapped. "That is an emotionally distorted summary from a junior nurse." Linda stepped forward. "It is also accurate." Rourke's phone buzzed. He looked down, read the message, and his face hardened. "Security footage just came in from the physician entrance." Rachel looked at him. Rourke's voice was flat. "The 2 attackers entered with the temporary vendor credentials, approved at the desk by an electronic override." Langford blinked. "That's impossible. Your system says otherwise." Hayes asked, "Who authorized the override?" Rourke looked at Hargrove. The hallway changed again. Hargrove's face emptied. "What?" Rourke stepped closer. "Your login." "That is ridiculous." Langford turned toward him. "Miles." Hargrove lifted both hands. "My credentials were obviously stolen. This is a hospital system. People share terminals constantly." Rachel watched him carefully now. Not his face, his hands, his breathing. The way his anger arrived 1/2 a second late. Hayes noticed Rachel watching and looked back to Hargrove. "Doctor, where were you 15 minutes ago?" "With administration." Langford said he was with me for part of that. "For part," Hayes repeated. Hargrove's voice sharpened. "You cannot seriously be suggesting I helped armed men enter an ICU." Rourke said no one suggested it. Rachel's eyes stayed on him. "Yet." Hargrove turned toward her. "You." The word came out full of all the hatred he had tried to polish all night. "You come into my department under a false name, violate every medical standard in the building, drag the federal government into my hospital. And now you imply I am part of an assassination attempt." Rachel stepped closer. "No." Hargrove breathed hard. "I imply you are afraid." He laughed once. "Of you." Rachel shook her head. "Of being exposed." That struck him. Maya saw it. So did Hayes. So did Keene. The smallest fracture crossed Hargrove's expression before he sealed it. Rourke's phone buzzed again. He read the next message. "Media has the Trauma Bay video. They also have an interview clip." Langford closed his eyes. "Interview." Rourke looked at Hargrove. "Dr. Hargrove spoke to a local station 9 minutes after leaving the OR hallway." Maya stared at him. "You talked to the news." Hargrove's mouth tightened. "I corrected a dangerous false narrative." Linda's voice dropped. "You mean you created one?" From a television mounted silently in the ICU family waiting area, a red breaking news banner rolled across the bottom of the screen. The volume was off, but the caption was visible. "Chaos at St. Adrian Medical Center after unauthorized emergency surgery." A blurred image appeared beside the anchor, Rachel leaning over Caleb's open chest. Then Hargrove appeared in a clean shirt, speaking with controlled concern. Maya could not hear him, but she could read enough from the captions. Doctor says patient safety was endangered by rogue nurse. Keene stared at the screen with open disgust. General Reeves looked at Hargrove. Very slowly. You used my son's blood to protect your reputation. Hargrove's face flushed. I protected the integrity of medical care. Rachel turned away from the television. Her voice was quiet. Men like you always find a camera before they find the truth. For once, Hargrove had no polished answer. Hayes moved toward him. Dr. Hargrove, I need you to come with me and answer some questions. His head snapped toward her. Am I under arrest? Not right now. I am not leaving my hospital under escort like a criminal. Linda said, then walk like a doctor. 2 officers guided the wounded attacker toward the elevators on a stretcher guarded by Rourke's men. The unconscious attacker was cuffed to a hospital bed and wheeled separately. The ICU nurse finally sat down and covered her face with both hands. Maya approached Rachel slowly. Are you all right? Rachel watched Hargrove being led away. Yes. Maya shook her head. No, not hospital, yes, real yes. Rachel looked at her. For a moment, the mask thinned. Maya saw exhaustion there. Not ordinary tiredness. Something older. Something that had lived behind Rachel's eyes before Providence, before St. Adrian, before the fake badge and the quiet shifts. Rachel looked toward Caleb's room. I have been worse. That's not the same thing. No. Maya waited. Rachel rubbed her thumb against a dried spot of blood on her wrist. I forgot how loud civilian rooms are when they break. Maya did not know how to answer, so she did not try. Keene stepped beside them. I checked his lines. He is stable for the moment. For the moment, Rachel repeated. Keene looked at her. You know you are finished here. Rachel nodded. As Rachel Cole, yes. I meant in this hospital. She looked down the hall where federal personnel were securing the floor. That was always temporary. Maya felt the words land harder than expected. You were just going to leave. Rachel did not answer. Maya's face tightened. Of course you were. Rachel turned to her. Maya. No, don't do the quiet thing. Not after tonight. Rachel stayed still. Maya's voice shook. I handed you the scalpel. I watched you hold a man's heart. I found out your name from a credential folder in a hallway. So don't stand there like none of this touched anyone but you. The hallway noise softened around them. Rachel looked at Maya for a long moment. Then she said I was sent home from a place that did not exist on paper after people died who were not supposed to be there. I signed documents that erased them. Then I disappeared because the living were becoming harder to protect than the dead. Maya's anger faltered. Rachel continued, voice low. I came here because no one knew me. Because a badge with 2 letters felt safer than a rank with too many ghosts attached to it. Because if all I did was start IVs, hang blood-right names on whiteboards and keep people warm, maybe that would be enough. She looked through the glass at Caleb. It wasn't. Maya's eyes burned. Rachel's face closed again, but not fully. Keene said quietly, You cannot erase what you are by changing the letters on a badge. Rachel looked at him. No. Good. The general came out of Caleb's room. His face had returned to command, but his eyes were different now. Major Ward. Rachel straightened slightly. Sir, my son has enemies outside this hospital. Yes, sir. And apparently, at least one inside its systems. Yes, sir. I need to know whether he can survive the next 12 hours. Rachel looked at Keene. Keene answered honestly. He can. He can also die in the next 12 minutes. That is where we are. The general absorbed that without flinching. Rachel added, He needs stability, blood ventilation, infection control, surgical reevaluation, and no more surprises. General Reeves looked down the hall toward the family waiting room television, where Hargrove's face still glowed silently beneath breaking news graphics. There will be surprises. Rachel followed his gaze. Yes. Rourke approached with his phone still in hand. We traced the vendor override to a remote access point through the hospital network. Hargrove's credentials were used, but not necessarily by him. Cyber is pulling logs. The attackers are refusing to talk. Hayes joined them. One of them had a tattoo removed recently. Scar tissue on the wrist. Could be former military, could be contractor. Rourke nodded. Contractor is more likely. General Reeves' voice lowered. Who hired them? Rourke looked at Rachel. We are working on it. Rachel said Caleb knows. Everyone turned toward her. He had evidence, she said. He knew he was being followed. He called his father. He survived the crash. That means whoever sent them does not know how much he passed on or where it is. Keene looked through the glass. He is intubated and sedated. For now. General Reeves' face hardened. You think they will try again? Rachel looked at the locked ICU doors. I think they already have 3 times. The road, the ER narrative, and this floor. Maya whispered the ER narrative. Rachel turned toward the television. If they cannot kill him, they discredit the person who saved him. Confuse the timeline. Bury the truth in liability, and turn the hospital into the story instead of the murder attempt. Rourke nodded grimly. That tracks. Hayes looked at Rachel. You speak like you have seen this before. Rachel's eyes did not move. I have seen men die twice. Once from wounds, once from reports. Silence followed. Not empty silence. The kind that made people decide who they were going to be before the next order arrived. Linda Mercer walked up with a fresh scrub top and towel folded over one arm. She handed them to Rachel. You look like a crime scene. Rachel accepted them. I am. Linda's mouth tightened. I did not trust you. I know. I still don't know if I do. That is reasonable. Linda looked toward Caleb's room. But I know what I saw. Rachel held her gaze. Linda nodded once. Get cleaned up, then come back. If this floor is going to be a fortress, I want someone here who knows where the walls are weak. Rachel looked down at the scrub top in her hands. For the first time all night, she seemed unsure. Not of danger. Of being allowed to stay. Keene noticed. So stay, he said. Maya added softer now, please. Rachel looked at them. Then at Caleb. Then at the hallway where blood glass and bad truth still waited under fluorescent light. She turned toward the staff restroom. I'll be 2 minutes. Rourke watched her go. General Reeves stood beside the glass, his hand resting against the window but not touching it fully, as if the barrier itself was keeping him upright. On the television, the anchor changed graphics. The new banner appeared beneath Hargrove's image. Federal officials arrive after soldier survives mysterious crash. Maya read it. Then she looked at Caleb's monitor through the glass. The rhythm kept going. Thin, fragile, defiant. Behind her, the stairwell doors were now guarded. The elevators were locked down. Armed men checked badges. Nurses moved quietly from room to room, caring for the sick while history rearranged itself in their hallway. Rachel returned in clean scrubs that still did not erase the blood beneath her nails. She clipped no badge to her chest this time. Rourke noticed. So did Maya. So did Keene. Rachel walked to the ICU desk and looked at the floor map pinned beside the medication room. Show me every service corridor. Linda stepped beside her and pointed. Rachel studied the map for 5 seconds. Then she looked toward Caleb's room. Move non-critical patients out of this wing if beds are available. Keep monitors routed to central. Lights low in the hall, bright in his room. No one enters alone. Hayes listened, then turned to her officers. You heard her. Langford, standing pale near the elevator, began to object. Major Ward does not have operational authority in this hospital. General Reeves looked at him. She does now. No one argued after that. Rachel turned toward the glass. Inside, Caleb Reeves lay motionless beneath tubes, dressings, and machines, unaware that his survival had pulled a hidden war through the doors of a civilian hospital. Rachel's reflection stared back at her from the glass. For 2 weeks, that reflection had belonged to Rachel Cole. Night nurse, quiet employee, forgettable badge. Now the woman in the glass was Major Rachel Ward again. She did not look away. The monitor beeped once. Then again. A living rhythm in a building full of people who had almost let rank fear and pride bury the truth. Rachel placed one hand lightly against the glass. Hold on, Sergeant, she said. Her voice was too quiet for anyone but Maya to hear. We are not finished yet. The words remained against the glass long after Rachel lowered her hand. Hold on, Sergeant. Caleb Reeves did not move. The ventilator lifted his chest with mechanical patience. The monitor kept its fragile rhythm, each green rise on the screen small enough to fear, steady enough to defend. Outside the room, St. Adrian Medical Center had changed shape. It was still a hospital. Nurses still checked drips. Respiratory therapists still adjusted oxygen settings. Somewhere down the hall, an elderly woman with pneumonia whispered for water. In another room, a sedated man fought a fever no one outside his family would ever hear about. But beneath all of that, the floor had become something else, a perimeter. Rachel stood over the ICU map with Linda Mercer, Officer Nora Hayes, Colonel Rourke, and General Thomas Reeves. The paper was wrinkled beneath her fingers. Red pen marks circled stairwells, elevators, supply closets, service corridors, staff lounges, medication rooms, and blind corners where cameras did not reach. She tapped the west stairwell. Too exposed. Hayes nodded to one of her officers. Post 2 there. Rachel moved her finger to the service elevator. This is worse. It comes up from loading pharmacy laundry and waste disposal. Everyone forgets service paths because they don't look important. Rourke looked at one of his men. Lock it from below. Put eyes on the panel. Linda crossed her arms. You lock service elevators, pharmacy will scream. Rachel looked at her. Let them scream from downstairs. Linda held her gaze for 1 second, then gave a short nod. Fair. Peter Langford stood at the edge of the station, his phone in one hand and panic in the other. His shirt was creased now, the collar wilted, the administrator's polish wearing thin under fluorescent light. We have legal counsel demanding a statement, he said. We have media outside family members calling, and the board chair wants to know why armed federal personnel are controlling an ICU floor. General Reeves did not turn from Caleb's room. Tell your board chair my son was nearly murdered in that ICU. Langford swallowed. With respect, General, we still do not know whether the hospital itself was targeted, or whether this was an isolated breach involving outside actors. Rachel looked up from the map. 2 attackers entered with the hospital credentials. 1 guard was pulled away with a staged disturbance. Someone leaked video from the ER within minutes. A local physician gave an interview before the patient reached ICU. Langford's mouth tightened. That physician is being questioned. He is not the only problem. Langford frowned. What does that mean? Rachel looked toward the medication room. It means hospitals are built on trust. Trust in badges, trust in scrubs, trust in clipped voices and routine movement. Tonight, someone used that trust like a weapon. No one answered. A nurse at the desk stared at Rachel as if she wanted to look away, but could not. Maya stood nearby in clean scrubs Linda had found for her. The blood on her shoes remained. She had tried to wipe it off and stopped halfway through because the smears would not disappear, only spread thinner. Her hands still shook when she wasn't using them. Rachel noticed but did not mention it. Instead, she said Maya. Maya looked up. Yes, you stay inside the inner ring. What inner ring? Rachel pointed to the taped line Rourke's team had placed across the floor outside Caleb's section. No one crosses that without being checked by Hayes Rourke's people, Linda, Dr. Keene, or me. Maya's eyes widened slightly. You want me in there? Rachel looked at her. You saw his baseline. You know the lines. You were there from trauma bay to OR. If something changes, you'll see it. Maya's throat tightened. You trust me? Rachel's answer came without pause. Yes. The word did something to Maya that praise never had. She nodded once. I'll stay. Keene emerged from Caleb's room pulling off gloves. Pressure is holding. Not pretty, but holding. Lactate is ugly. Coags are uglier. He needs blood correction warmth and silence. Rachel said any sign of recurrent tamponade. Not right now. Drain output is watched. Chest repair is holding. Abdomen is packed. He's walking a wire. General Reeves looked through the glass. How long before he wakes? Keene exhaled slowly. If he wakes cleanly, not soon. We keep him sedated until he can survive fighting the tube. His body has been through impact shock arrest, open chest resuscitation, cardiac repair, abdominal trauma, and massive transfusion. The general absorbed every word, like a man taking fire without moving. "Can he hear us?" Keen hesitated. "Maybe, maybe not." Rachel stepped closer to the glass. "Talk anyway." The general looked at her. Rachel did not soften the sentence. "The dying hear more than we think. The living need fewer regrets than they admit." For a moment, General Reeves said nothing. Then he opened Caleb's door and stepped inside. No one followed. Through the glass, Maya watched the general stand beside the bed. He did not look like a general in that room. He looked like a father who had spent his life preparing for other people's sons to die and had never found a way to prepare for his own. His lips moved. The machines answered in steady rhythm. Rachel turned away before the moment became something she had no right to witness. Rourke's phone vibrated again. He read the message and his expression darkened. What Rachel asked. "Hargrove's interview is spreading. Local outlets are framing this as a rogue nurse incident. Someone pushed the clip hard across multiple accounts. Bot behavior, probably paid amplification." Hayes frowned. "Someone is shaping public perception in real time." Rachel looked toward the muted television in the family waiting area. On the screen, the same blurred trauma bay footage played under a new banner. Mystery. Nurse identified in soldier surgery scandal. Maya whispered, "They know your name now." Rachel looked at the screen. Her face gave away almost nothing. Almost. Rourke said not the whole name. "Not yet. We're scrubbing what we can. You won't stop it." "No." "Then control what matters." Rourke nodded. "The evidence." Rachel turned. What exactly was Caleb carrying? Rourke lowered his voice. "Encrypted drive. Internal testimony. Payment routes. Names linking a private logistics contractor to illegal weapons movement and assassination contracts disguised as security incidents." Hayes stared at him. "That sounds bigger than procurement fraud." "It is. Where is the drive?" Rourke looked at General Reeves through the glass. Caleb told his father he hid the original before the crash. He had a decoy on him when EMS arrived. Rachel's eyes narrowed. Who knew about the decoy? Too many. "Then, whoever sent those men may think the real evidence is still on him." Rourke nodded. "Or they came to make sure he never says where it is." Rachel looked at Caleb's room. "Then he is not only a patient, he is the map." The words settled heavily. A sharp alarm sounded from inside Caleb's room. Everyone turned. Maya moved first, crossing the taped line with Rachel half a step behind her. Keen was already pushing through the door. Inside, Caleb's pressure dipped. 74 systolic. Heart rate climbing. Maya checked the lines. Blood is running. No kink. Pressor pump active. Keen leaned over the chest dressing. Drain output. Rachel looked at the collection. Not enough for this pressure drop. Maya checked the ventilator. Peak pressure's up. Rachel's eyes moved to Caleb's neck, then to the monitor, then to the abdomen. Temperature. 95.1, Maya said. "He's cold." Keen nodded. "Trauma triad is coming for him." Rachel looked at the blood warmer. "Warm everything. Increase active warming. Check calcium." Maya moved. Keen's hand hovered over the abdominal dressing. He may be bleeding again below. Rachel watched the pressure. 68. The room tightened. General Reeves stepped to the corner out of the way, but unable to leave. Rachel looked at him. "Sir, talk to him." The general stared. "Now." He moved beside Caleb's head. His voice was low, close to the ear. "Caleb, it's Dad. You are in Providence. You are in a hospital. You are not on that road anymore." The monitor kept falling. Rachel looked at Keen. "He needs OR again." Keen's face hardened. "He may not survive the elevator. He won't survive staying here if the abdomen is opening." Keen looked once at the pressure, then at the patient. "Call OR." Maya reached for the phone. Before she could dial, Caleb's right hand moved. Barely. A twitch against the sheet. Rachel saw it. "Hold." Keen looked at her. The fingers moved again. Not random. 2 taps. Then a pause. Then 1 tap. Rachel stepped closer. Caleb. His eyelids fluttered under sedation. The ventilator moved air through him. He could not speak. could barely exist. But his fingers tapped again against the sheet. 2. Pause. 1. Pause. 3. Rourke stepped into the doorway. Rachel looked at the pattern. Is that a code? General Reeves had gone pale. He used to do that as a kid. Rachel did not look away from Caleb's hand. What does it mean? The general's voice was rough. Book cipher. We played it when he was little. Numbers for words on a page. Rourke moved closer. What page? Caleb's fingers tapped again. 1. 1. Then stopped. His pressure wavered but did not drop further. Maya whispered, "He's trying to tell us something." Rachel leaned close to Caleb's ear. "You're alive, Sergeant. You don't have to finish it all right now." His fingers curled weakly. General Reeves gripped the bed rail. "He called me at midnight. He said if anything happened, I should remember the book." Rourke said, "What book?" The general closed his eyes for one brief moment. "The Red Badge of Courage." His mother gave it to him before his first deployment. Hayes, standing just outside the door, said, "Where is it?" General Reeves opened his eyes. "At my house, in Virginia." Rachel shook her head. "No, if he used it tonight, he had access to the page." Maya looked around. His belongings. Keene said trauma bay, whatever EMS brought in. Rachel turned toward Linda through the glass. "Find his property bag." Linda was already moving. Caleb's pressure rose slightly. 82. Maya watched the monitor with disbelief. He stabilized. Keene's jaw tightened. "Temporary." Rachel nodded. "Everything tonight is temporary." Minutes later, Linda returned with a sealed property bag carried by one of Rourke's agents. Inside were the remnants of Caleb's uniform, a cracked watch, a soaked wallet, dog tags, a folding knife, and a small water-damaged paperback wrapped in plastic. The Red Badge of Courage. General Reeves stared at it as if it were a bone. Rourke opened the plastic carefully. The pages were damp but readable. A folded corner marked one section. Rachel looked at Caleb. Page 11. Maya remembered the taps. 1, 1. Rourke turned to page 11. Rachel said 213. Rourke counted silently across the lines, then words. His expression changed. "What?" He repeated the process twice more. Then he looked up. "Chapel." Hayes frowned. "The hospital chapel." Caleb's fingers moved once. A single tap. "Yes." Rachel straightened. "He hid it here." Rourke looked toward the hallway. "How?" Rachel answered. "He had time before the crash." General Reeves shook his head. "He never reached the hospital," Maya said quietly, "unless someone else brought it." They all looked at the property bag. Keene said EMS inventory. Linda checked the tag. Bag sealed at arrival. Rachel looked at Rourke. "Who rode with him?" "2 paramedics." "Where are they?" "ER debrief." Rachel looked at Hayes. "Secure them. Not accuse. Secure." Hayes nodded and left. Rourke turned to one of his men. "Chapel, now." Rachel stopped him. "No." He looked back. "If the evidence is there, they may know the same code. If your men rush the chapel, anyone watching moves first." Rourke's jaw tightened. "What do you suggest?" Rachel looked at Maya. Maya blinked. "Me." Rachel nodded. "Your hospital staff. You can move without turning every head." Maya's face went pale. "I am not trained for this." "No, that's why they won't look at you first." Keene cut in. "Absolutely not." Maya looked at Rachel, frightened but steadying. "What am I doing?" Rachel's voice was calm. "You go with Linda and Officer Hayes. Not alone. You walk like you are checking a family room issue. No running, no radios in hand, no heroics. If anything feels wrong, you leave." Maya swallowed. "And if we find it, you do not open it. You bring it to Hayes." Rourke did not like it, but he understood. 5 minutes later, Maya walked down the quiet hallway with Linda and Officer Hayes carrying a clipboard as if it were armor. The hospital chapel sat near the old wing, small and dim, tucked between a family consultation room and a vending alcove. It smelled of wood polish, candle wax, and old grief. Rain tapped gently against a stained glass window showing a pale blue river beneath a white sky. Maya's heartbeat was so loud she thought Hayes could hear it. Linda whispered, "Breathe." "I am breathing." "Then do it quieter." Hayes checked the doorway, then nodded. They entered. No one was inside. Rows of wooden chairs, a small altar, a basket of prayer cards, a box for written intentions, a shelf of donated books, Bibles, hymnals, and worn paperbacks left by families who had needed something to hold. Maya moved to the shelf. The red badge of courage was not there. Linda checked under the altar. Hayes checked behind the kneeling bench. Nothing. Then Maya saw it. A prayer card had fallen halfway behind the candlestand. Not fallen. Placed. Its corner showed a handwritten line, "For courage under fire." Maya lifted it. Behind it, taped beneath the candle ledge, was a small black drive sealed in clear plastic. Her throat closed. Hayes. Hayes crossed the room quickly. At the same moment, the chapel door opened. A man in a hospital maintenance jacket stepped inside. He was holding a toolbox. His eyes went first to the candlestand, then to Maya's hand. Hayes drew her weapon. "Stop." The man dropped the toolbox. It hit the floor and burst open. Not tools. A compact pistol slid across the chapel tile. Linda grabbed Maya and pulled her behind the chairs as Hayes fired once. The man dove behind the doorway, firing blindly back into the chapel. A candle shattered. Wood splintered from the chair beside Maya's face. Hayes shouted into her radio. Shots fired. Chapel. Suspect armed. Maya clutched the drive so hard the plastic cut into her palm. Linda's voice was low and fierce in her ear. "Stay down." Footsteps pounded outside. The man fired again, then ran. Hayes moved to the door, weapon raised. "Do not follow," Linda snapped. Hayes stopped, furious but disciplined. "I have the drive," Maya whispered. Linda looked at the small plastic-wrapped object in Maya's hand. "Then move." They returned under escort fast, now no pretense left. By the time they reached ICU, the floor had locked down completely. Rourke took the drive without a word and handed it to a tech specialist who had arrived with a hardened laptop. Rachel looked at Maya's shaking hand. "You're bleeding." Maya looked down. A splinter had cut across her knuckles. "I'm fine." Rachel's eyebrow lifted slightly. Maya let out one breath. "I know, bad answer." Rachel cleaned the wound herself. Not because it was necessary. Because Maya's hands would not stop shaking until someone held them still. "Did you see his face?" Rachel asked. Maintenance jacket. Dark hair, white male, maybe 40s. He looked at the candlestand first. Hayes joined them. He knew where to look. Rourke's tech looked up from the laptop. "Drive is authentic. Encrypted, but the header matches Caleb's keychain. There is also a timed release protocol." Rourke stepped closer. "What kind of timed release?" "If the right passphrase is entered, it pushes the package to multiple federal and media endpoints." General Reeves looked at Caleb through the glass. "He planned for this," Rachel said. "He planned to die." No one corrected her. The room fell silent. Then Caleb's monitor alarmed again. This time the rhythm faltered. Keene was inside in 3 strides. Pressure dropping. Abdomen is going. Rachel turned to Rourke. "You have the evidence. Move your war away from his bedside." Rourke looked as though he wanted to argue. General Reeves spoke first. "Do it." Rourke took the drive and left with 2 agents, Hayes following to secure chain of custody. Inside Caleb's room, Keene looked at Rachel. "We have to go back to OR." Rachel nodded. "Now." General Reeves moved toward his son. Rachel stopped him with one hand. "Sir?" His eyes were wet now, though his face had not broken. Rachel said, "Tell him before we move." The general leaned close to Caleb's ear. "You did it, son. We have it. You hold the line now. That is your only order." The monitor beeped weakly. Rachel looked at Maya. "Blood." Maya lifted the bag. "Ready." Keene opened the door. "Move." The bed rolled out of ICU, surrounded by guards, doctors, nurses, and the thin, furious insistence of life. This time, Hargrove was not in the elevator. This time, no one asked who was in charge. The OR took Caleb again. Hours dissolved under lights. Keene and Patel fought the bleeding. Rachel did not cut this time. She stood where she was useful, passing information, reading pressure changes, seeing trouble seconds early, speaking only when necessary. Maya stayed until Linda ordered her to sit, then stood again the second no one was looking. Dawn began somewhere beyond the sealed windows. The storm weakened, not stopped, weakened. At 6:41 a.m., Keene stepped back from the table, bleeding controlled. Anesthesia checked the numbers. Pressure stable on support, rhythm steady. Patel closed her eyes for half a second. Maya pressed one hand over her mouth. Rachel looked at Caleb Reeves. Still alive. Twice brought back. Twice protected. Still hanging by wires, medicine stitches, and stubborn blood, but alive. By sunrise, the truth had begun moving faster than the lie. The encrypted drive reached federal investigators. Arrest warrants started before morning coffee cooled in offices 3 states away. Hargrove's interview vanished from the hospital's official channels, but not from the internet. Nothing vanished there. It only changed owners. Officer Hayes found the maintenance attacker wounded near a loading dock after he collapsed from blood loss. He lived long enough to give a name. Not the name behind it all, but a door. And doors could be opened. In the ICU waiting room, General Reeves stood before Rachel as the first gray light of morning reached the rain-streaked windows. For a long moment he said nothing. Then he extended his hand. Rachel looked at it, then took it. His grip was firm. A father's gratitude held inside a soldier's restraint. "You saved my son." Rachel answered the same way she had before. "I bought him time." General Reeves shook his head. "No, Major. You gave him a battlefield he could survive." Rachel did not know what to do with that. So she released his hand. Maya stood nearby watching the woman she had known for 2 weeks and would spend years trying to understand. Linda walked up with 2 cups of coffee and handed one to Rachel. Rachel sniffed it. "This smells terrible." Linda said, "Then it's fresh." For the first time all night, Rachel almost smiled. Almost. Across the hall, Caleb's monitor kept its rhythm. Beep, beep, beep. A quiet sound. A living sound. Outside, news crews filled the hospital entrance. Administrators prepared statements. Federal agents sealed evidence. Police guarded exits. Families woke in waiting rooms with stiff necks and unanswered questions. The world was already trying to turn the night into headlines. Rogue nurse. Mystery surgeon. Military cover-up. Miracle in Providence. None of those words fit. Not really. Rachel stood outside Caleb's room and clipped her old hospital badge back onto her scrub top. Rachel Colhorn. Maya noticed. That name still works. Rachel looked through the glass. For now, is it even real? Rachel touched the badge once. It became real enough. Maya stood beside her. "You leaving?" Rachel watched Caleb's chest rise beneath the ventilator. The answer should have been yes. Ghosts survived by moving before people loved them, before enemies found them, before quiet places turned into homes. But the ER downstairs still had patients. Mrs. Harlan still needed her CT result. Daniel Price probably had an appendix that needed removing. Marcus in bed 6 would wake angry and ashamed and still human. And Maya Dawson had handed over a scalpel when fear gave her every reason not to. Rachel said, "Not before my shift ends." Maya smiled faintly. "That's the most nurse thing you've said all night." Rachel looked at her. It was a long night. Linda raised her coffee. "It is still night until I clock out." Keene came from the OR hallway, exhausted cap in one hand. He is stable enough for ICU. No victory speeches. No optimism beyond the numbers. But he is still here. Rachel nodded. "Good." Keene studied her. "You know the board will come for you." "Yes." "The media will come too." "Yes." "Hargrove's people will try to make this about policy." Rachel looked at Caleb. "It is about policy." Keene frowned. She continued, "It is about what policy is for. To protect patients or to protect pride." Keene absorbed that, then nodded. "Fair." The elevator opened. 2 officers escorted Hargrove past the ICU entrance. His face was gray now, his hair no longer neat, his eyes fixed ahead as if looking at anyone would make him real. Hayes walked beside him holding a folder. He saw Rachel. For 1 second, hatred returned. Then something else. Fear. Rachel did not move. Hargrove looked away first. Maya exhaled. He finally stopped talking. Linda sipped her coffee. Miracles do happen. No one laughed loudly, but the sound that passed between them was close enough. Rachel turned back to Caleb's room. The morning light touched the glass. For 2 weeks, people had seen what they wanted when they looked at her. A quiet nurse, a stranger, a woman easy to overlook, a badge with small letters. They had not seen the hands. They had not seen the history behind them. They had not seen the cost. But Caleb Reeves had lived long enough for the truth to catch up, and that was enough. Rachel stepped into the room one last time before returning downstairs. The machines greeted her with their steady language. Caleb lay still pale-bandaged, breathing through plastic and power and will. She adjusted nothing, touched no line, changed no setting. She only stood beside him. "You held," she said quietly. The monitor answered. "Beep." She turned toward the door. Behind her, Caleb's fingers moved against the sheet. Once, then again. Rachel stopped. Maya saw it from the hallway. Rachel. Rachel looked back. Caleb's eyes remained closed. His fingers tapped once more. Not a code this time. Not a message. Just movement. Life insisting on itself. Rachel's face softened in a way no one in St. Adrian had seen before. Then she stepped out and let the door close gently behind her. Downstairs, the ER waited. Rain still clung to the windows. Coffee still burned in the pot. Monitors still complained. Families still needed answers. Bodies still arrived broken and afraid. Rachel walked back into the department and borrowed scrubs with blood under her nails and a false name on her badge. At the nurse's station, the clerk looked up. "Room 9 is asking for you." Rachel picked up a chart. "Tell him I'm coming." Maya fell into step beside her. "You know he thinks you outrank everyone." Rachel looked ahead. "Number." Maya waited. Rachel turned into the hall. "I just know when someone needs help." The automatic doors opened at the ambulance bay. Cold morning air moved through the ER. Somewhere beyond the rain, another siren began.